I come from a group that has been performing immediate implants since the beginning, at least since I was trained as a periodontist 20 years ago. But it was at the beginning essentially in the anterior region, and immediate implant was often going with immediate loading, for the aesthetic zone in order to provide something to the patients. But now it's true that immediate implant has expanded also to the posterior region, and that's something I was not doing in the past. And for me, for the patient, immediate implant is always associated in principle with a flapless procedure. I mean, if we do immediate implant, we should be able to not raise a flap, and this is just less invasive. There are several, but I would say first and very first, patient selection. Then I would also say planning, prosthodontic and surgical planning. Implant positioning, but that is much related to planning. And finally, hard and soft tissue management. Okay, the best feature for immediate implant. In principle, I would go for an implant that allows you to get a proper primary stability. So certainly an implant that would be a bit more aggressive, but it's not only about the implant, it's also about how you're going to prepare your site.